The following equipment should be available at the time of the examination. You can have a pen light or an otoscope or an ophthalmoscope for additional lighting, a magnifying lens if needed, gloves, a tongue blade for examining the mouth, a gauze pad for the tongue, and a centimeter ruler to measure any lesions you might find. In addition, you will need a Q-tip for examining the hair. Begin the examination with the patient seated and facing you. The first thing you want to do is an overall assessment of the skin. First, scan the skin for any variations in skin tones, looking for features such as pigment variation, erythema, flushing, pallor, or cyanosis. Lightly touch the skin to feel for any variations in skin temperature or increased sweating. You can check the turgor or elasticity of the skin by pinching the skin over the forearm and quickly releasing it. The skin should quickly return to its normal shape. For the scalp and hair exam, first evaluate the hair for any abnormal changes in textures, fractured hairs, and evaluate for patterned hair loss. Then palpate the scalp gently to feel for any tumors, cysts, papules, or plaques, or rough, gritty areas that might indicate the presence of actinic keratoses. In males, the scalp can be easily evaluated for any tumors by simply rubbing your hand over the hair like this, revealing all aspects of the scalp. In a female, the hair should be parted using a Q-tip at regular intervals so that all the scalp can be evaluated. The face is the most common area for basal and squamous cell skin cancers, so careful inspection of this region is important. Lightly palpate the face for presence of any gritty, rough keratotic areas that could indicate the presence of actinic keratosis. Look very closely at the central areas of the face, as these are common areas for basal cells and squamous cells to develop. Inspect the neck for evidence of sun damage and/or tumors. Also at this point, you can lightly palpate the lymph nodes. Metastatic head and neck carcinomas frequently involve the anterior and posterior cervical lymph nodes. For the eyes, nose, throat, and ear exam, begin with the eyes. Check carefully at the sclera for any evidence of injection of blood vessels or evidence of jaundice. Evert the eyelids to examine the palpebra conjunctiva on both the upper and lower eyelids. Examine the nostrils for tumors and erosions if this is indicated. For the ears, lightly palpate the ears for presence of rough, gritty keratotic areas. Examine all aspects of the ears for tumors, with special attention to the post-auricular area where tumors may go undetected. So carefully examine both ears in the posterior portion of the ear and the posterior portion of the helix. Using a tongue blade and a light source, examine all surfaces of the oral mucosa, looking for erosions, vesicles, pigmented lesions, brown lesions, and white lesions. To examine the tongue, you will need to grasp the tongue with a gauze pad and move the tongue side to side and up so that all the mucosal surfaces under the tongue are seen. When examining the arms, examine all surfaces and pay close attention to the elbows, which is a common site for psoriasis, and the antecubital fossa, which is a common site for atopic dermatitis. The extensor arms are an area of good deal of sun exposure, so again lightly palpated for a presence of any keratotic papules. Repeat the same procedure on the other arm. The hands are common sites of involvement for many common skin disorders such as irritant and allergic contact dermatitis, and less common disorders such as the connective tissue disorders. The hands are also site of great deal of sunlight exposure, so you'll again want to carefully look for the presence of actinic keratoses or any tumors. The palms of the hands are also a site potentially for psoriasis and irritant or allergic contact dermatitis. When examining the fingernails, examine the nail pate carefully for any abnormalities such as thickening, onycholysis, horizontal or vertical defects, and for any evidence of clubbing. Examine the nail bed for pigment, color change, or splinter hemorrhages. If any erythema is noted at the cuticle, you can examine the cuticle more closely with the use of a dermatoscope for any dilation or irregularities in the nail bed capillaries, which could indicate the presence of a connective tissue disorder. The trunk examination in males can be done with the patient remated in the seated position. Many clinicians perform the trunk exam in females with the patient lying down, allowing for appropriate draping. When examining the trunk, pay very close attention to the central upper chest, especially the V of the chest, which is an area of frequent sun exposure and sunburns, and also an area where skin cancers can develop. In a female, you would want to lift up the breast to notice any changes in the skin below the breasts and check for candida infections. This also is the point at which you could examine the axilla for any absence of hair, which could indicate thyroid disease or other disorders. And also at this point, you could check for adenopathy in the axillary region. When examining the patient's back, you want to pay special attention to the upper back, which also is the site of a good deal of sun exposure in most patients. This particular area also is the site of melanomas, with up to 40% of melanomas in men are located on the back, especially in this region. You want to complete your exam all the way down to the waist area. For the examination of the abdomen, you should ask the patient to lie down for the rest of the exam if they have been in the seated position. When examining the abdomen, spread and lift the skin as needed if the patient is obese to look under all body fold areas. Carefully examine the area of the umbilicus, as this is a common area for psoriasis. Skin cancer is a relatively rare location on the abdomen, but you want to look for that also. At this point, you can also examine the inguinal lymph nodes for any evidence of lymphadenopathy. For the purpose of this video, we're going to skip the examination of the genitals. However, in most full-body skin exams, that examination should be included. For the examination of the legs, have the patient remain in the supine position. Examine the anterior and medial surfaces of both legs. Over 40% in melanomas in females are on the legs, so it is important to look very closely for pigmented lesions, or any other lesions that might be suspicious for skin cancer. The knees are a common area of involvement in psoriasis, so they should be examined closely. And the popliteal fossa is a common area for atopic dermatitis and should also be examined. The lower legs should be examined for any evidence of stasis dermatitis or edema by pressing over the shin bone. Check both feet for any evidence of pallor or decreased temperature, as this may indicate vascular disease. Carefully examine all aspects of the surface of the skin, looking for any ulcers or sores. Specifically check the toe webs, as these are a common site for fungal infections, and then examine the toenails. As you can see in this patient, there is some onycholysis present. Fungal infection in males is actually quite common. At this point in the examination, the patient should be asked to turn lying down on the examination table so that the buttock and the posterior surface of the legs can be examined. If this is difficult or uncomfortable for the patient to perform, the examination can be done with the patient lying on their side. This is also the point at which you would do the examination of the buttocks. However, for the purposes of this video, we're going to skip the examination of the buttock area. When examining the legs, pay close attention especially to the popliteal fossa, which is a common site for atopic dermatitis, and to the calf area, which is a relatively common site for melanoma in females. With the patient in the prone position, you have another opportunity to examine the feet. This is especially good position for examining the plantar surface of the foot. Look for any evidence of ulcers, calluses, or any color change in the feet. This also gives you another opportunity to examine the toe webs for presence of any fungal infections.